I'm talking about alternatives, I'm not talking about herbal medicine or a detox or something like that. I'm talking about pharmaceuticals. So one study, for example, done in the state of Michigan, and it was a multi-center study, meaning they looked at patients, they gathered data from patients at 5 different major medical centers and aggregated that data and found that only a small percentage of women who were going in for a fibroid or another reason for a hysterectomy that was non-cancer, right? Cancer would be an appropriate reason, but only a small percentage were ever told that there were other medical things that they could do, including medical things they could do to shrink the fibroid so that if they did ultimately still need to go into surgery, they could have the fibroid removed and not their whole uterus removed. So there's a lot of lack of knowledge amongst physicians that there are alternatives. And, not to be callous, but I am a doctor, so I'm speaking for my own profession. There's a huge amount of financial incentive to choose to do a surgery over recommending a pharmaceutical. It's night and day when it comes to what ends up in your pocket at the end of the day. And it's not just your pocket, but it may be the hospital you work at gets much more money from you having more patients get surgery. So there's a lot of incentivizations built into the system that we don't really think about or know about as individual patients. And it sounds almost conspiratorial when I talk about it, but it's actually very real. So, it comes back to what we were talking about before, which is how do you manage your own medical care? How do you be the CEO of your own health? And I think it's really tough. I think as women, as human beings, we shouldn't have to be. We should be able to go in. When you go to your car mechanic, you don't have to know everything about your car to make sure your car gets cared for properly. You don't have to research about your carburetor. You hope that your mechanic knows what they're supposed to do and does it. But when it comes to heavy bleeding and whether you should get that hysterectomy or not, first of all, it's terrifying because sometimes the word cancer is tossed in there, even when there's no cancer. But if you do it now, then you have to worry about cancer later. Well, okay, I'll take that. I'll take door number 3, and if you're not told that you can use GnRH inhibitors or other pharmaceuticals to shrink a fibroid, how are you supposed to read that, or learn about that when half the words aren't even that pronounceable? And there's so much noise on the internet. Where do you even go and trust? So I think it gets the burden ends up falling on the person who's got the problem to sort it out. And then you go to your doctor and you're like, well, can I try this medication first? And they're saying, well, where'd you get your degree, Dr. Google? You end up just shutting up and going in for the surgery. And I'm not saying that the surgery is wrong. I've sent patients with fibroids in for hysterectomies too at times. They're anemic, they're exhausted, they're bleeding, they're peeing all the time because the fibroid's so big, it's sitting on their bladder or sitting on their bowels and they're constipated, sex hurts. They have pelvic pressure all the time. So there's a time and a place for sure. It's just that we're jumping to that as step number 1 when it should be step number 5.